And we are live on Facebook and we're also live on Zoom. So there we are, two platforms at the very least. Thank you all for joining us. Thank you for joining the Novi Public Library's For the Health of It program. And this time we're talking about lung cancer prevention and early detection. It's really lung cancer awareness. So I appreciate you being with us. We have partnered with Ascension Providence Hospital along with the American Cancer Society to bring you this series of programs. My very special guest is Ting Jin. She's here. She's a Pulmonary Nurse Navigator. Did I get that right?
Yes.
Got it right. Very good. Welcome. I'm so glad you could join us this evening.
Thank you for having me.
Sure. Very good. So if you are watching us from Facebook or Zoom, if you have any questions or comments along the way, you can type it in the comment section. If you're on Facebook, you can type it in the chat section if you are on Zoom. But for the people who are here watching us from Zoom, you get a little special privilege because we're having a little Q&A. I call it a little quiz section we're going to do right now. I'm going to open up this poll to see how much you know now to begin with before the program. And then we're going to take the exact same quiz at the end of the program just to see if you're really listening and how much you've accomplished in your knowledge over. You could get these all right. I don't think I did those, but I'm going to give you open it up right now. And then please let someone give me a nod if you see it. Did you see it, Ting?
Yes, I did.
Okay, everyone see. So I'll give you a couple of seconds to go through and check off what you think the answers are. I won't address who's getting them right or wrong. So just. Also, at the very end of the program, we're going to have a spin the wheel. So if you've attended through Zoom, you're going to have the opportunity to win a really fun prize. I wish I was eligible to win, but I'm not. I'll show you as soon as this poll is over. I thought these were some challenging questions. You can't see what we're.
I'm sorry.
It's okay, though. That means I really have to listen so I can get the answers right on the next one, right?
Yeah, there is some statistic questions in there. Sometimes it's hard to get.
That's good. So just bear with us for those of you who are watching on Facebook and you're wondering, why are we pausing? We're just doing this little brief poll for a few more seconds to see someone's still working on it. So no problem at all. You know, we were talking just before we logged into the program, how we can really tell that daylight saving time is kicked in, how dark it got earlier today. Huh? Really tell that daylight saving time. I can hear myself coming.
I know, it's me. Sorry.
You, Ting.
I need to turn it off. This is the
all right. We're going to wind down in about 10 more seconds.
Oh.
For the,
oh, you turn
this
thing
questions.
off.
I can hear myself. 9,
Yeah.
8. Okay, we are ending the poll now. Okay, so we ended the poll and we're going to get started with our program. It's all going to be on to you. And you know what? Let me tell you what we're going to win. At the end of the program, for those of you all who have registered through Zoom, you'll have the opportunity to win this. Novi Public Library has a cafe. Did you know that? $25 gift card. It's not just a regular cafe. It's they serve Starbucks. You know, so isn't that fantastic? My favorite Starbucks holiday drink right now is the caramel brulee latte. Love it. Love it. What's your favorite, Ting?
Mine for the holiday would be peppermint mocha.
Yep, that's my second favorite. Without further ado, let's talk about lung cancer awareness. Take it away, Ting.
Okay, so I'm going to introduce, my name is Ting. I'm going to introduce myself briefly. I am the program coordinator and the nurse navigator for the Pulmonary Nodule program at Ascension Providence in Southfield as well as in Novi Park. I've been working in oncology for the past 27 years at Providence, starting as a staff nurse and move on to be a research nurse, then nurse navigator for the breast program in Novi. Then I was overseeing the cancer registry at Providence. Now, last year, I moved into this role because screening and early prevention, early screening are my true passion as a nurse. Since I've been seeing so many, I know if cancer is diagnosed at early stage, the outcome can be totally different. So now I'm gonna start sharing my screen.
Okay, sure.
Okay. You guys can see okay?
Yes, it's perfect.
Okay. So today I'm gonna focus on, okay. So today I'm gonna focus mainly on pulmonary nodules and also early screening for lung cancer. First of all, I'm gonna start talking about screening. As you all know, survival is heavily depends on the stage when the lung cancer is diagnosed. 5-year survival for stage 1A lung cancer is about 70 to 90%. So it's pretty high, but less than 10% if the cancer is diagnosed at later stage, for example, stage 3 and 4. Only 15% of the lung cancers are diagnosed at stage 1. Over the years, there's many screening studies. People want to see if early screening can make a difference. So many studies were conducted, which show that 55 to 85% of lung cancers can be found at stage 1. So why not doing that, right? What are the pulmonary nodules? Pulmonary nodules is abnormal growth that forms in the lung. Believe it or not, most nodules are benign, which means not cancerous. They may be caused by infections, irritations, or pollutants, scar tissues, or some sort of autoimmune disease. So most of the pulmonary nodules actually was incidental findings after they're getting imaging test for example, in preparation for some minor procedures or, so sometimes your PCPs will order, your primary care physicians will order a chest X-ray before a lot of standard testings. Just make sure your lung is good enough to take on that procedure. So it depends on the characteristics and size of the nodule. Family doctor may recommend we can just watch it and see if this nodule is going to grow over time. Or if they think this nodule looks really suspicious, they would like to do a chest CT right away. Or they might wait a little bit and do it in 3 to 12 months and repeat that. There are further testings may be needed if the nodule really looks suspicious on CT, and we just want to make sure this is nothing. So one thing we can do is a bronchoscopy, which we can just insert a little instrument through your nose, mouth to take a look inside. Another thing is we can take a little piece of a tissue to get a definitive diagnosis. The newer technology nowadays, I don't know if you ever heard about, is the PET-CT scans, which we can combine with CT and provide us a 3-dimensional image. Will highlight the areas has higher metabolic activities. That way we can differentiate between benign and malignant tissues. So like breast cancer, we do mammograms as the early screening tool for early detections. So for lung cancer, do we have anything similar? Yes, we do. But we only have one, which is the low-dose CT, is the only recommended screening test for lung cancer for adults who have no symptoms, but at a higher risk. So United States Preventative Services Task Force provided guidelines and recommendations for, for high-risk patient who needs the low-dose CT screening. The populations we're described here are adults, age 50 to 80 years old. They must have some sort of smoking history, has to smoke at least 20 packs per year. And they might quit smoking, but it was within the past 15 years. So those patients will be eligible to do this low-dose CT as well. Depends on what's the appearance on the low-dose CT. We may recommend it different follow-up for the patients. If it's a benign appearance, we normally recommend to do another annual screening low-dose CT in 12 months. If we say it's like probably benign, then we'll do more in the shorter, in the near future, like 6 months, we'll repeat the low-dose CT. If it looks really suspicious, then we might do a PET CT right away. We might do a CT guided biopsy right away to get some tissue. It all depends on, how it look on the low-dose CT. I'm going to stop here and see if anyone has any questions for me at this point.
Ting, I do.
Okay.
It was funny because I wrote down like if you smoked in the past, had a 2-pack a day history, and I was going to say 20 years, but the criteria I see is 15 years. And so if you've had a smoking history and quit within the last 15 years, then you meet that criteria. If you're 50 to 80, correct?
Correct.
Okay.
Then you can actually, a lot of times, your PCPs will take that family history from you, like saying, what's your smoking history? And considering the age and smoking history, and they will recommend low-dose CT. We're trying to educate the primary care physicians at this point as well, because they're so busy. Sometimes they just forget to ask certain questions. Then so if the patient is better educated, or they can actually approach their family physicians to ask, saying, this is my smoking history. Should I do a low-dose CT at some point? So to just get a baseline. Yes.
What about secondhand smoking? If a person has been around a smoker, would they qualify as well? Possibly.
Yes, that's a very good question. I know secondhand smoking is a very high risk factor for a patient getting lung cancer as well. So they don't have a specific guidelines for that, because we don't know the person who live in the household, how much they smoke, So it's really hard to put on paper saying you are qualified to, get a low-dose CT. But low-dose CT is relatively cheap radiology testing, because it's only a little over $100, I believe. So if you feel you're higher risk to get lung cancer, I would at least to get a baseline low-dose CT. That way later on you have something to compare to.
Okay, thank you, Ting.
You're welcome.
I want to make you aware, if you are watching from Facebook, if you have a question, please type it in the comment section. I am monitoring it there. And if you are watching from Zoom, if you don't want to ask the question yourself, you can type it in the chat section. Thank you.
Any more questions? So I'm going to move on. You can always ask if you think of something else later on. So we have a pulmonary nodule program at Providence, and the goal of the program is to see patients with suspicious lung nodules within 10 days of we see this on the scan. Then this program actually features the following. We can help you along the way. We can see the patient within 10 days of the identification. We provide regular communications with the referring physicians. We also help you to schedule certain follow-up studies and appointments. And we have a lot of state-of-art diagnosis and interventions at Providence, at both campus. And if we see something we really need to discuss, then we'll present this case at the program nodule, the multidisciplinary thoracic care team. We get together every 2 weeks. We discuss all the high-risk cases and provide recommendations to the primary care physicians. This is our team right here. The top one is our thoracic surgeon, Dr. Hamoud. And we have pulmonologist, which is Dr. Farah. We have many of them, but I just put some main players on the screen. Then we have our medical oncologist, Dr. Adam Foreman, right there. Behind the scene, of course, you have the radiation oncologist. We have the pathologist. If you have a tissue removed, we need to look at it. And also we have the radiologist behind the scene to read all the scans. This is my contact information. I'm going to put it on the screen. So if you have any questions you couldn't think of right now, but you want to ask me later, you're welcome. This is my contact info right on the screen. So in conclusion, low-dose CT is the only recommended screening test for lung cancer for adults who have no symptoms but at higher risk. And screening should be performed in individual deemed high risk. Of course, I just mentioned. Screening should occur as part of the organized program where patients can be carefully monitored. Program should take a multidisciplinary approach to provide best patient outcome possible. And this is just a little program. It's going to happen on November 11th, which is a collaboration between Gail? Is this between Novi Library with us again?
This one is not.
This one is not? Oh, okay.
I don't think so.
It'll be.
This one is just Ascension.
Okay, this is education program as well. We have our thoracic surgeon, Dr. Hamoud, and the medical oncologist and the radiation oncologist. They're going to host a session on lung cancer. So if anybody is interested in this, you can see the information right on the screen as well. It's going to happen on November 11th, which is going to be, today is what?
It's Thursday.
9th, this Thursday, actually.
Thursday. Mm-hmm.
Yeah, between 6 to 7 p.m.
Ting, I have a question again too. When we talk about the low dose CT, and do you think, with breast, the mammogram, or with prostate, you have the DRE and the PSA? And I would just remember it took a while before colonoscopies were the gold standard and was covered by insurance 100%. How long do you think it will be? Are we headed that way for the low dose CT?
Yes, if you actually meet all the criteria, majority of, I know Medicare cover it, majority of the insurance cover as well. And we see a upward trend just at Ascension. Every month, I see more and more little CT being performed. The numbers just keep going up. Just compare with this month and last month, it was like more than 100 cases than last month. So
You know,
I think the worst is getting out.
That's what I
And-
was gonna ask.
Yeah,
And Ting, if
That's
you'd
what I
like, you
was-
can unshare your screen, then we can chat a little bit more about the lung cancer awareness.
absolutely.
Sure. I'm sorry, Gail, were you going to ask another question?
I was just gonna say, you know, when we think about like during the month of October, we have everything is inundated with, you know, get your mammogram, and you hear all these stories. Or
Right.
in September with prostate screening, but here we are in November and it's lung cancer awareness. But you really don't see the media taking hold and saying you need to go and get your, if you fit a criteria to get your
Right.
low-dose CT screening. And I guess my other question is too, Ting, is lung cancer still like of all the cancers, is it still number one?
Correct.
Isn't
And it's
it-
more because a lot of patients are diagnosed at later stage. So the survival rate compared with breast cancer and prostate, you just cannot compare. It's more deadly, more just, that's why we're trying to focus on screening and preventions.
Mhm.
That way we can diagnose those cancers at early stage. If you see the stage 1, actually the survival rate for 5 years is pretty high.
That's really scary. Yeah, I saw
Right.
those numbers as well.
Yeah.
Ting, tell me, maybe you included it in your presentation, but reiterate, who is at risk for lung cancer? Who is most at risk?
Well, of course, people who smoked before, and secondhand smoking, like Gail mentioned before. And the radon actually is the third high risk factors. If you in your house, if you never test your radon level, you really need to look into it, because those air confined in your household sometimes can cause really damage there. And also genetic factors as well. Of course, you might expose certain things, chemicals at work. That's another risk factors as well. So
And I
you wanna
guess too,
stay
it is important for people, even if they don't smoke. I think I can think of a handful of people who passed away from lung cancer and they were not smokers. So
Mhm.
even if you're not a smoker, you still need to take note. As Gail talked about, it doesn't get nearly the attention that it should, despite it being the number one.
Right.
Mhm.
I
What
know.
about warning signs? Can you give us a little more about what you can
Warning
look
signs?
for?
I see a lot of patients, they just come in, they don't, they just generally don't feel well. They feel tired, they might have a little cough. Sometimes some patients may have like cough up blood. But normally it's just generally don't feel good. Or if this cancer actually is in the advanced stage, sometimes they might have altered mental status because the cancer went to their brain already. Or sometimes they have bone pain, like saying my hip hurts or my back hurts. Then they do bone scans and or MRIs, they see some lesions there. So that's normally how they find out they have lung cancer.
So usually because it has metastasized to say the bone.
Yes, a lot
or
of
the
times.
brain?
Yeah.
Wow.
Especially for certain like pathology type of lung cancer. Yeah.
I am monitoring. Once again, I want to remind you, if you are watching on Facebook, or even if you're here on Zoom and you have a question, please type it in the chat or comment section, or either open your mic or camera if you want, and you can ask the questions yourself, as we have a professional here who can answer your questions about lung cancer prevention, awareness, as best as she can. So please don't hesitate if you have another question.
So if you are smoking, we have a lot of tools we can help you to quit smoking. Nowadays, even for medications or patch, we have many different ways we can help. Even we have a smoking cessation class we offer at the cancer center as well, both campus. And so we have many tools we can help you to quit smoking. It's never too late to quit smoking. I remember.
Important to say, yeah, because some people think I've been smoking for 30, 40 years. It's never too.
I know. My dad, this is just a personal story. My dad actually smoked for many, many years because he had so many meetings. So every time they have meetings, everybody light up a cigarettes because it just make the meeting go by faster, I guess. So he smoked probably for 40, 50 years. Then he always tell me, he said, well, so-and-so, he quit smoking, then he got lung cancer right away. So I said, where does that idea come from? It's just, there's no data supporting that. So one day, I don't know what happened. He just say, okay, I'm going to quit cold turkey. So he quit in his 70s. So he's still living and he's doing really well. So it's never too late to quit smoking because it's not good for your lungs anyway. Later on, you're going to have breathing problem, all these issues later on. So it's just not good. So.
Very good. Yeah, that's a good something to share, something to consider. Is it time to take the test again? I think I heard some of those answers that were in that pre-test. I'm going to pass it out again for people to do it as a post-test. Is that okay, Ting?
Absolutely.
Okay, I'm gonna share it right now. For those of you who are on Facebook, just bear with us. This will be for the people who are on Zoom to try this test one more time and see how you do. I don't think it's saying that. I want to do that.
I took the test.
Okay, I'm putting the test up there again. Do you see it? Let me know, make sure everyone sees it.
Yes, we can.
Okay, so I'm gonna give you a few minutes. You should be able to whip right through it and get these answers correct, all right? And don't forget, if you are attending here, you have a chance to win. We're gonna do right after this test, this $25 gift card brought to you by the Novi Public Library. It is to the Novi Public Library's Cafe. And they don't just have Starbucks, they have those sandwiches and other things too, but I'm just stuck on the Starbucks thing. Did I ask you what's your favorite Starbucks holiday drink?
I don't have a favorite holiday drink. My favorite Starbucks drink any time of year is the white mocha with chocolate. That's my go-to all the time.
I have to get
I like that too.
White chocolate mocha. Is that
you writing it down, Ting?
Yeah.
And I tell you the story. Before we had a conference room in our building, a lot of our meetings were over at the hospital. So I would, when we have to go over to the hospital, I would stop and treat myself to that at the Starbucks in the lobby area. And that's what I would get. I would treat myself. That was my treat.
We deserve treats, don't we? Okay, I think we are ending the poll in 10 seconds. 9. Okay. There's the end poll button. I'm not good at this. Okay, here's the share the results button. I'm going to go on and click that.
Okay.
Wow. You guys are good. That's the correct answer. Number one question is 15% of lung cancer is diagnosed as stage 1. Very nice. I cannot see the results for the second one.
The second one they said.
Down. Yeah, all of the above, which is correct. So the growth can be formed in the lung, may caused by any of those infections, pollutants,
Irritations and
exposed.
pollutants.
Yep.
Scar tissue.
Even when you have COVID, sometimes you can develop a scar tissue in your lungs. Just any sort of infections, stuff like that, you can develop scar tissues. And of course, autoimmune disease, because you're against your own tissue. So sometimes.
Question number 3.
Mhm.
Most nodules are, is it benign or cancerous?
Yeah.
Which one is it?
I'm gonna
Benign.
say A.
Yep. A.
Benign.
Yep.
What is the only recommended screening test for lungs?
It will be the low dose CT. Oh my
That
goodness.
was the winner.
100%. Yes.
Either we had some very smart people from the beginning, or
I'm
they were
telling you.
listening very attentively. The last one is, what are some of the recommendations for USP STF for LDCT? Come on, don't make fun of me.
Wait, did I mess
Help me,
this
Ting.
up?
Is it supposed to be? How did you mess it up?
I think I messed this up a little bit. Actually, any adults age 50 to 80 years old is a correct answer. And
Okay.
you have smoked 20 pack per year, and you have quit within the past 15 years. That means you're still higher risk for to get lung cancer. And male doesn't mean you're at higher risk for lung cancer. I want to make that clear.
Got it. Perfect.
Yeah.
Well, thanks for
So
joining.
male as well as female.
That was fun.
Yeah.
All right. So now we're going to do something even fun again. There's this card. I keep showing it to you. We're going to do the spin the wheel. Are you ready? Spin the wheel, or person assistant. Share your screen. Your names are on there. We're going to do see who wins the gift card.
Oh my goodness. How exciting.
Okay. It's spinning.
It's a Bill?
It looks like
Yes.
it's Bill. I know,
Oh,
Bill.
yay!
Come on. Can you hear the applause part? Can you hear it? Did you hear that? I love it. I wish you had
I
more.
heard the applause. I
So
applaud.
Bill, we'll contact you. We know who you are. So you won the $25 gift card. Yay.
Yay. Go get some holiday drinks.
All right. So this brings us pretty close to the end of our program. I want to make sure, Ting, you have some things you want to close out with. You're more than welcome.
Well, the most important thing I want to tell everyone is early screening, and don't do bad things. Keep, live healthy and life. Don't get into bad habits, and early screening, of course, and you do well.
Very good. Thank you so much, Ting, for
You're welcome.
presentation.
Thank
It was
you, Ting.
very insightful. And on behalf of Ascension Providence Hospital, American Cancer Society, and the Novi Public Library, we thank you for joining us. Our next For the Health of It program will take place December 7th. It will be mental health and nutrition. So once again, December 7th at 7 p.m., go to our website, novilibrary.org. You can register for the program, and we hope to see you there. Once again, it'll be, if you want to get a chance to win fun prizes, log on and register through Zoom, and you can
I'm
participate.
going to be there.
We hope to see you on Facebook. Thank you, everyone. Have a good night.
Bye-bye.
Thank you.
Thank you.